Good morning. If I could ask anybody out there who's a healthcare professional for the next 10 minutes to try to put away the acronyms, the ACA, the ACO, the PPO, the POS, the EOB, the insurance NO, everything else that's involved in the healthcare system, and just take a step back to who you are as a patient, as a caregiver. The only two words I care about for the next 10 minutes are YOU and ME. And that's the purpose of the conversation here. So everybody here this morning decided to get out of bed, come over here. You're probably having a great morning. I hope everybody's been great so far. And I'm hoping that you're also at the top of your game. Your kids are great, your family's great, your career is great. Everything's just rocking and rolling. Because that's where I was in 2005. 35, 3 kids under 3, a gorgeous wife, great career, everything is going great. And then it's not. And for me, what happened was I started to feel fatigued. I started going to sleep at 3 o'clock. My 3-year-olds were singing me a lullaby at 3 in the afternoon. Something's not right. So I go to my first doctor, my primary care physician. 8 rounds of antibiotics later, no solution. Go to the pulmonologist. Adult onset asthma. Really? I woke up on Thursday with asthma? Didn't really make sense to me. Ear, nose, and throat doctor. Nodules in my vocal cords. And each of these doctors, 3 or 4 medications to me. Next doctor I went to, dermatologist, Lyme disease. Next thing you know, the avalanche has hit, and you don't even realize it. 12 medications, a pile of documentation this high, no communication within the system whatsoever, trying to stay ahead of it all. And I'm as educated as anybody else is in this room. It's not a matter of intelligence. The avalanche hits, you're underwater, it's either for yourself or a family member, and everybody out here knows it. You've all experienced it, or you will experience it in those capacities. What makes it harder, though, is there's really no place to coordinate that care. Everybody in the system says that they talk about coordination of care, but it's incomplete. It's event-based. It's institution-based. My care coordinator in my hospital was my discharge planner. Our incentives were not aligned. I went to my employer to ask about my healthcare situation. They could help me on a limited basis. But you go to your employer and ask them about mom who's not on your plan and see how much coordination can be there for you. And it's really interesting to think through some of the challenges beyond the communications and the coordination. And some of these are actually deeper ingrained. Getting parts of the marketplace to actually work together. My CAT scan from one institution could not be read at the other institution. Look, medicine is a noble profession. There is nothing altruistic in the business of medicine. Right? Those institutions don't want to be able to read each other's systems. It's Coke and Pepsi. And you really start understanding that as you're within the system. And that's not to say that people in the system, and this is not doctor bashing, it just is what it is. The other thing that you find in the system, to a degree, is some carelessness and laziness. In my case, when I was diagnosed with my thymic cancer, which, by the way, stage 4 disease, thymus is a heart, oops, it's right where the microphone is, or was, and it was probably 5 times the size, helps you in utero with immune system development. Once you're born, it shrinks down to the size of a pea, except for 500 of us, in which case it explodes in the chest cavity and creates real issues. And so here I am, before my diagnosis, completely confused, get my diagnosis. First phone call is to my insurance agency, my insurance company. They couldn't find it in their drop-down menu. They tried to convince me I had tonsil cancer, tongue cancer, and they did it with the empathy that you would find when you call 411, and you know that pizza place has been there for 40 years, but they tell you it's not. And you just start working your way through the system. And believe me, I've had a lot of time to think about our system. Most of it's sedated, but I've had a lot of time to think about it. And here's really the deal. You get the system that you create. So if you go way back when, and I'll use the acronyms, early 1980s, we started in the managed care industry. You had your HMO, you had your gatekeeper, and then they were sort of your medical home and all the other jargon. Right? You went to your doc, you went to Marcus Welby. Marcus Welby figured it out, you went elsewhere. We didn't like that. We wanted more. We wanted more choice. We wanted to be able to go to the doctors that we should be able to go to the physicians, go to the entities. So along come some more acronyms, PPO, the POS, the direct POS, EPO, any letters that you want. And you got your more choice. But nobody told you about the greater responsibility that falls to you. When you get rid of the gatekeeper, you are the gatekeeper. And so healthcare is a right, but it's not an entitlement. And by that I mean, look at some other inalienable rights that we have, right? Life, liberty, the pursuit of happiness. In all three of them, you and I have an obligation back to the system. Liberty is not just to be taken for granted. If you don't vote, you get the government that you need. In healthcare, it's equally right. We all have a role in the healthcare system. So, enough with the problems, the solution. Going forward, who wants to be the quarterback? Where's that quarterback going to be in your healthcare and your family's healthcare? How does that happen? We're in Chicago, so the Bears, which I have to just do. I did it poorly. My kids will be watching this, so the Bears have a huddle before every play, right? And it's clear in that huddle who the quarterback is. Not so for the Jets, but we're going to stick with the Bears right now. Yeah, Rex Ryan will tweet something later. Rex and I get along like this. But it's an interesting huddle. The patient's not in it. We talk about patient-centric care. I go to all these conferences, see all these people on the stage. I never see a patient. You look around the huddle, and you're talking about the patient, right? And then you look around the huddle, and you go, wait, the patient's not here. The patient's the football. How did the patient fall out as an object, or a subject, not the object of the sentence? How is the patient not there? And that's our responsibility. That's our responsibility as we move forward in the system. So there are things that patients and caregivers, because a lot of this falls to the caregivers, must do. One, we must be accountable. We talk about accountable care organizations. We talk about the future. Again, listen, accountable care organization. Where do you hear the patient or the caregiver in that? The only time I felt patient-centric was when I was on the surgical table and everybody else was around me. Otherwise, and I've done this, I've started a charity for thymic cancer. And we'd have 400 doctors come together, right? And I'd bring together disciplines of surgeons, radiologists, oncologists, pathologists, until everybody told me nobody brings a pathologist, and then we didn't invite them going forward. And I thought for sure the doctor from France had never met the doctor from Japan, and we were doing great things. Never in my wildest dreams did I think the oncologist, the radiologist, and the surgeon from the same major cancer center in New York had never met. How do you have an integrated system when the only person who knows all the names of all the players is the patient, and I'm unconscious half the time? So culturally, things need to change within the system. The siloed natures, and they're not all things that are going to be regulated, but things that do need to change. But accountability, we all have to be accountable, and we have to be comfortable being accountable. Number two, organization. The organization is going to fall to us. Your primary care physician cannot do it all. The hospital system is not going to do it all. God forbid our insurance company does any of it, because none of us really trust the insurance industry. So who else is left? It's you. It's me. And frankly, it's going to be a professional class of folks that evolves to help us organize this glut of information that none of us can make sense of, much less under duress. Elizabeth was kind enough to mention the company that we're building. Well, my passion is helping people navigate the healthcare system. And there are professionals, nurses, social workers, insurance billing and claim folks that can be a help here. But we are all going to have to be organized and figure out how to use those tools. And then finally, we have to be our own advocates. Elizabeth spoke about her experience. You all have your own experiences. If you see something, you say something. If something doesn't look right, you say it. And that's a cultural thing that we all still need to get over, because healthcare largely is paternalistic, and that's the way that we've all approached it. But you're beyond that point. A smart consumer is the only consumer. In healthcare, you are a consumer. Frankly, if your doctor doesn't want to play the way that you want to play, find another doctor. But we all have responsibilities to the system. We're accountable to the system as much as it is to us. And so, in closing, I just want to leave you with a thought or two. There is an acronym that I take very, very seriously, and I look at it every day on my wristband, and it's GEM, J-E-M. It's my three children's names, Joshua, Erica, Matthew. Because I want to show them that a thymus can change the world, because I want to show them that I get the opportunity like this to speak in front of a group like yourself and say, we can do something. We have to do something. And then I have to say to you, and I beseech you, and I think Chicago Ideas Week and things like that are brilliant. Find your passion. You're here on a Sunday morning. Make a difference. We all need to make a difference. It's not an option, and that's our way forward. So thank you very much, and enjoy the program.